Ekso is a robot that you can wear that provides power to the legs. Ekso is FDA cleared to help physical therapists treat people recovering from stroke and other conditions that have caused them to lose their ability to walk. Every design choice in Ekso was made with one goal in mind: create a rehabilitation tool for PTs to help you get more and better steps.
Good morning. Welcome to Summa Rehab Hospital. I'm Caitlin Bush. I'm the Director of Therapy Services, and I have Derek Steele, our outpatient therapy lead, here today. So we are very excited to introduce the newest piece of technology we have here at Summa Rehab, which is the EksoNR. And we're really excited about the exoskeleton because we feel that it helps our patients get better sooner. We've really been able to use the device with a lot of different patients with diagnoses, including brain injury, stroke, incomplete spinal cord, and really anyone with lower extremity weakness. So what we found with the Ekso so far is that we can get patients up who normally would take 3 to 4 people and a lot of therapists hands-on input with the patient, and with the Ekso we're able to get them into the exoskeleton and really stand them up, and they have this great upright posture. They're able to stand for longer, and they're really getting the feedback from the machine of what they're doing right, and the fact that they are standing upright and straight for a longer period of time. So also the Ekso helps us get in more gait training and steps with these patients. So for example, we have a gentleman here right now who had a pretty severe stroke, and typically it would take 3 to 4 people to stand this man up. He suffers from a pusher syndrome, so he doesn't have good awareness of where his body is. And in the Ekso, we're able to control all that and stand up and increase his stand time and bring him back to that center of balance. With this gentleman, we would not be able to ambulate him at this point because it would be too difficult. And actually yesterday he took 40 steps. So it was this huge accomplishment for him, and it will be so much more helpful for him to get better at standing and transferring and walking and getting home with his family. So we're really, really excited about the Ekso and what it has to offer for our patients. So what I'm going to do is I'm going to let Derek talk a little bit about how we can use the Ekso for inpatient and outpatient therapy.
Yep. So once again, my name is Derek. I do a lot of the outpatient physical therapy here, kind of heading up, trying to increase our usage of the EksoNR and really trying to dive into how it's beneficial for each patient. It could be a neurodiagnosis or not. Just anybody that we want to get up in this better, safe, and efficient standing position, and it allows us to control our setup with limiting the amount of therapists we need and just increasing the potential, the benefit from each patient use with this device. So it's really helped the continuum of care from our patients that we've had an inpatient, that we've used the EksoNR with, and now into our outpatient program. We use it with these same patients. We've been able to track the progress as well as seeing just optimize our functional outcomes. So with specific patients that have been difficult to gait train using some of our other equipment, like Caitlin alluded to, sometimes takes 2, 3, maybe 4 therapists, and it's very inefficient and sometimes unproductive. So this is a robotic device that we're able to continue to use with these patients to increase that step tolerance or step amount that ultimately is allowing us to increase allows us to promote neuroplasticity, which is our ultimate goal to help our functional outcomes. We've got numerous examples and some videos and pictures of a young spinal cord injury that initially in inpatient we were unable to effectively perform gait training. Now with the EksoNR, we've not only initiated it, but we pretty much optimized all the settings to pretty much allow him to make as much functional gains as possible. And with our goals, we're now being able to achieve our goal of being a functional ambulator.
So another thing that I want to highlight about the exoskeleton is it really allows for us to individualize the care for the patient. So with EKSO, you can modify the settings so that if just your right side is weak or just your left side is weak, you can modify the settings so that the EKSO is just giving you what you need. So it allows you that free motion on your leg, on your other leg, to have a more normal gait pattern. And by doing that, it gives you some feedback scores. So the patient, it's not just the patient is really engaged in driving their therapy session. It's not just a passive device that's walking for you. The patient is doing a lot of work, and you can see that directly with those feedback scores the machine provides for you. So it's really cool, and it can be dynamic. You can walk backwards in it, you can walk sideways in it, so you can really challenge their balance and improve their quality of gait. And Derek said, he was talking about neuroplasticity, and neuroplasticity is essentially how you get that function back when you've had something happen to your brain or your spinal cord. And what one of the principles of that is practice, and perfect practice makes perfect performance. And so the more repetitions that you can get, the better your outcome will be. And so the EKSO really highlights that. And you're able to practice walking at a better quality for longer, and so the patients really, really benefit from that.
And I fell to the floor when I got to and my right arm collapsed, and I was laying on the floor like a baby seal, flopping around, trying to get out of bed. This was a week ago Sunday. And I didn't want to go to the hospital, but I said, how the hell could I get to the bathroom? I had to go to the hospital. So here we are. My wife said at first she said right away you had a stroke. Well, they never confirmed that for a couple of days.
And the stroke left you with some weakness on this right side, huh?
Yeah, my right leg.
Can you show how much you can move your right arm? Can you lift it at all?
No.
Okay. What about this right leg?
Sitting on my back. Sitting in the
Okay. So we've been doing that robot, right?
Right.
What do you think about it?
It's a marvelous machine.
Yeah, do you think it's helping you?
I hope so.
Were you able to walk in it today?
Oh, yes.
Uh-huh. And how far can you walk over ground without it?
Not at all.
Okay. And how far did we go today?
Well, we did 200 and something steps.
Mm-hmm.
The other day we did 50.
Yeah. So already a huge progression, huh?
Yes.
Good. Any other thoughts about it?
Well, whoever invented it is a wizard.
Isn't that true?
I found that I like using this machine because it helps me with my recovery by letting me get on my feet, and it's not painful in any way. I find it very comfortable.
So we're excited that we have this new outpatient program here at Summa Rehab Hospital. We're able to help serve our patients that have been inpatient here, as well as other facilities from the community. We want to bring them back and specifically focus on neurologic impairments and how we can use our team, PT, OT, and speech to be able to focus on their impairments in the community and to be able to help meet their functional goals. The EksoNR has been a great, useful tool that has become pretty much a standard of practice for us here now to be able to meet our patients' functional goals. We're the only facility in the area, outpatient program specifically, that we're able to use the EksoNR with our patients. That it really provides that continuum of care from inpatient to outpatient. If you're interested and want more information about calling or scheduling an appointment, our number is 330-572-0999. 7225.
So we'd like to thank you for joining us today and hearing about our new outpatient program and also what our EksoNR has to offer. Keep following us on social media. I'm sure we'll be posting some of our patient success stories and you'll be able to see the device in action. Thanks.